Welcome back, everyone. If you are one of the 22 million Americans with sleep apnea, the Inspire device could be your option for a better night's sleep. I was just learning about this during the commercial break, and it's fascinating. Dr. Matthew Marino is an ENT surgeon at St. Luke's Hospital, and he's with us today to talk about the Inspire upper airway stimulation therapy. Thank you so much for being here.
Yeah, thanks for having me.
So tell me what Inspire is. How does this work?
Well, basically, Inspire is a new FDA-approved treatment for sleep apnea. It's a surgical device, so it's implanted in the body.
Okay.
It's done as an outpatient surgery, and essentially how it works, patients who have sleep apnea, the problem is essentially when they're sleeping, the airway is collapsing in on itself.
Right.
So essentially that blocks their airflow into their lungs, decreases their oxygen at night, and then it wakes them up. They can't get a good restful night's sleep. So what this device does is it sends some stimulation to the muscles of the tongue, stiffens those muscles, and instead of the airway collapsing, it keeps it open so they get good airflow into their lungs, keep their oxygen levels up, and thereby get a good night's sleep.
So that's a look at the remote control, basically.
That is the remote
device,
control,
and you've got one live on the set with us, too. So this is something that goes into effect minutes after you stay. When you hit the button, does it start immediately? Or does
essentially what happens is you use this remote, put it over the device, turn it on. There's a little delay on it, about 15 to 30 minutes, depending on how it's set.
To allow you to
fall asleep.
Okay.
And then once you're asleep, every time you breathe in, it's stimulating that muscle, and then you turn it off in the morning. You're not attached to any masks or hoses. You just have the remote next to the bed.
You took my next question.
Yeah.
Why might this be a better alternative as opposed to the Cpap machine?
Well, CPAP's generally a great option for sleep apnea. It's the standard treatment, but the problem with CPAP is tolerance. A lot of people can't use it.
Right.
They have claustrophobia. They roll over in bed, they sleep on their side, the mask comes off, and so they're at greater risk for high blood pressure, stroke, heart attacks, workplace accidents, because they're not getting any treatment. So for those patients who can't tolerate, this is a great option for them without any additional equipment, so they can sleep however they feel comfortable.
So now that you've got a good sample set here, what kind of results are you seeing?
So we've done about 30 implants so far, and on the data we have, we've seen about a 90% improvement in people's sleep apnea. So that's putting them at very mild levels or no sleep apnea, which is essentially alleviating their symptoms, and it reduces the risk for all those long-term potential complications from sleep apnea as well.
I know for sure that people watching right now, some are going to want more information. Where can they find that?
Well, we're doing a community health talk coming up on April 7th at St. Luke's Hospital. So that's one way that we can give them more information.
Sure.
And then they can also call the St. Luke's Sleep Lab. And I believe there's a number available for that.
We're going to give it to them right now
and
to learn more about.
They can find more information out there, and as far as getting consultations for the procedure.
Yeah, new cutting-edge technology. So to learn more about Inspire, there will be a free community education event on April 7th, as the doctor said, 6 p.m. at St. Luke's Hospital. You can visit St. Luke's-STL to register for the health talk. stlukes-stl.com to register for that health talk. And for more information about the Inspire device or the upcoming event, call 314-274-9429. Doctor, thank you so much.
Yeah, no problem. Thanks
Ken,
for having me.
how about that? That could be a big game changer.
I was glued to that. That is amazing. Good stuff.